So a very, very famous patient in psychology, neuroscience research as it relates to memory is Henry Gustav Moliason, who is better known as Patient HM, who when he was about 10 years old he actually fell off a bicycle and he hit his head, and he started having seizures, and these seizures worsened and they worsened. And then, they couldn't be controlled with drugs, so they were intractable, seizures. So actually, he had surgery. A decision was made to have surgery when he was 27 years old in 1953. And the surgeon removed the hippocampus, about two-thirds of his what are called hippocampi, one on the left and one on the right. These are kind of seahorse-shaped regions of the medial temporal lobe. They're old cortical regions. They're very, very important, it turns out, for memory function. And also other areas around it, like the parahippocampal gyri. So these are areas of cortex that were, around the hippocampus, the hippocampus. An area called the entorhinal cortex. Rhinal means nose, right? The removal of all these regions by the surgeons bilaterally on either side of his temporal lobe, medial temporal lobes there, was thought to be, probably fine because, it's where olfactory, neurons projected, to olfactory bulbs projected. So it was largely, in these early neuroanatomy texts, it was described as an olfactory region, the hippocampus and these other medial temporal lobe regions. So they thought maybe, he'd have some difficulty perhaps potentially with smell, right? So at age 27 in 1953, Henry Gustav Moliason, had a bilateral medial temporal lobectomy. They removed the temporal lobes, medial temporal lobes on both sides. And he suffered rather dramatic kinds of memory consequences because of that surgery. So he had, for example, a severe global anterograde amnesia. That means he lost the ability to transfer ongoing experiences into longer term store, subsequent to the operation. So going forward from the operation in what we call the anterograde direction, right? He had amnesia. He couldn't, he could be present. He could use his working memory. He had preserved working memory. He was able to, hold a conversation as long as he wasn't distracted. If he got distracted, he'd be, hello, who are you? It's nice to meet you. In fact, Brenda Milner, who's a famous, neuropsychologist who worked with him for over, 50 years actually, had to reintroduce herself every morning, to patient HM because he didn't have, the ability to transfer, experiences, that he was working with in memory into longer term, memory storage. He also, interestingly, had a temporally graded retrograde amnesia. So in the opposite direction, for events and experiences prior to the surgical intervention, he wasn't able to remember, specific, experiences and events after the surgery. And it was temporally graded, which means that, he had worse memory for experiences and events that occurred, closer to the actual, date of the surgery. And it, he could remember more the further back in time you went. So they call this a temporally graded, because it's graded in terms of time. Worse, closer to the actual, removal of the hippocampus and medial temporal lobe, and, gets better as you go back further. But it's very interesting as a finding in the sense that, the hippocampus and medial temporal lobe appear to be essential for the transfer of memory, into longer term store over, a much longer period, over like, let's say a 1 to 3 year period, because HM lost some memory, from up to 3 years prior to the surgical removal of his, medial temporal lobes. What he still had preserved, interestingly, was remote memory. Like, so for example, if I ask you to think about, your third grade classroom, or your where you where you used to get pizza when you were a teenager or something. Basically you can call up those memories, and they are not dependent on having an intact hippocampus or medial temporal lobe. Their storage site appears to be, more the actual networks in neocortex, that reflect, various aspects of those experiences that you're reconstructing and remembering. So, frontal lobe, really important for sort of working memory, working with memory, or immediate, like holding things in mind, chunking stuff, trying to keep things here right now. But then to transfer it to a longer term store over a period of 1 to 3 years, you require, the engagement and involvement for explicit and declarative memories of the hippocampus and the medial temporal lobe. And then ultimately, a lot of those memories are networked into, distributed regions here in the neocortex. So HM did, however, actually interestingly, have, other areas of preserved memory function. So Brenda Milner, had HM do this task called the mirror drawing task. So there was, let's say, a drawing of a star, a tracing of a star, and then another tracing around that tracing of a star. So there's a gap between the two, line drawings of the star. And then HM was asked to look at a mirror reflection of the star, right? And his own hand. So he couldn't look at his actual hand, but he had to use the mirror reflection to trace between those two lines. It's called the mirror drawing task. And it's not easy. If you try it, initially, and in our perception class we do this, it's not easy the very first time you try that. You make lots of errors. You go outside the lines, and every time you went outside the line, that was going to count it as an error. So if you graph that, initially HM's errors are really high up, but if he did like 10 trials on day one, then came back the next day for another 10 trials, he actually was significantly better the next day, in terms of his skill at, doing the mirror tracing. However, HM had no, explicit episodic declarative memory of the event because he has this global anterograde amnesia. He can't remember the individual learning events, in terms of explicit or episodic or declarative memory. However, he is still able to acquire the procedural memory, the implicit memory, the implicit skill. So this was showed you that in patients with damage to the medial temporal lobe, there was loss of declarative, explicit, episodic memory. That's dependent on the hippocampus and these medial temporal lobe regions. However, there is preservation of procedural and implicit memory, which suggests that they're dependent on different regions that weren't damaged, by the surgery that HM experienced. There are other tasks that Brenda Milner used also. There are what are called sort of priming tasks. For example, if I give you a list of words, nurse, melon, Egypt, things like that, and then I say, okay, what's this word? N-U, and then you say nurse, you're primed. You may not have remembered, the word right off the bat. If you had a list of 20 words, and nurse was on it, and you didn't get nurse, but if I start to prime you with the first few letters, you'd be able to recall that. And HM could still do that. There's also something called the Gollins partial or Gollins incomplete figure task, where you have, drawings, line drawings, and you start with just a little bit of the line drawing, and then the next panel you have more of the line drawing, and then more of it, and eventually you can see like it's a birthday cake or an airplane or something. The next time you get exposed to those, images, you're better at being primed by the partial drawing, in terms of your ability to remember, what the full, image actually happens to be. And HM could still do that as well. HM could still be classically conditioned. So, for example, and in a certain form of classical conditioning. So, there's this task called the eye blink paradigm, where they hook up this little. It looks kind of dramatic. They often, test this in rabbits actually, but they have a little, tube here that'll puff air at your eye. They'll have like a tone or a light, which is the conditioned stimulus that they'll, pair with the unconditioned. Stimulus, the puff of air. After several trials of that, you hear, puff, puff, puff. Your unconditioned response is to blink, and that blinking will become a conditioned response, right? And that would still happen to HM as long as the delivery of the tone or the light, overlapped with the delivery, basically of the puff of air in the training sessions. So HM could be classically conditioned as well. So in terms of amnesia, damage to medial temporal lobe, right, particularly the hippocampus, seems to be quite important. Intact perceptual, motor, and cognitive abilities for these individuals. In fact, HM's overall, kind of cognitive performance on various tasks of like attention and other aspects of perceptual tasks, things like that, he actually improved a little bit because he didn't have nearly as many seizures as he had prior to the surgery. Intact, immediate, short-term or working memory, which is not dependent on the medial temporal lobe, hippocampus. That's more frontal lobe, engagement. A severe and global sort of anterograde amnesia going in the forward direction. A temporally graded retrograde amnesia. Intact, very long-term memory, remote memory, which is more dependent on, neocortical networks, basically here. And a loss of declarative, explicit, episodic memory and not procedural or implicit memory.